Hi, everybody. This is Joyce Graff and Mike Loing. Good morning, Mike.
Hi, Joyce. It's great to be here with you.
Great. We wanted to talk with you all today because we know that staying home has its nice aspects, but it also has its painful aspects. And we thought it would be good to talk about, especially those of us who may have underlying medical conditions. There's some new stresses in our lives that we haven't dealt with before. So Mike, tell us a little bit about what's going on with you.
Well, I'm in an area where we've not had a tremendous outbreak of COVID-19. We've had 7 deaths in our county, which is a very low number. Right now, we've got about 149 people that's tested positive, and a significant number of them are already out of quarantine. And so it's something that's disrupting our lives, but it's not the threat that a lot of other people have. But even so, people are really concerned about this. Every symptom, everything that they can imagine, everything that they experience, they say, well, have I caught it? Who did I see? Who's got this? And what's going on? Is this something I really need to be concerned about?
Right. Yes. And I think certainly what's going on in my house is my son is immune compromised and I'm 76. So we're both high risk. So every little symptom is like, oh dear, is this the coronavirus? Or, what do I need to do about this? One of the things we discovered yesterday is that if you have an Alexa or a Siri device in your house, you can actually ask them to walk you through some questions that'll help you determine if you need to call your doctor or not. So you can say, what do I do if I think I have the coronavirus? And they will ask you a list of questions that's been vetted by the CDC. These are not just casual things. I noticed that Google search also has a list of questions you can go through. So if you're having a headache or if you're having a cough, what does this cough mean? Should I be worried about it or not? I think that panic is pretty close to the surface for my son who has an immune compromise. The panic is pretty close to the surface. We've been through 2 fire drills lately going through this. And so for me, I have to sort of peel myself off the ceiling and come back to a rational balance, and it's not easy. So
Uh,
how
it's
do you do that for you?
it's a challenge, and my wife, she's been out of work for a while. She's worked one week in the last 5, I think, and we've got an unusual living arrangement because we live in separate locations, but we're close enough to each other that we see each other almost every day. And she refuses to let me go to any stores or even to go to the gas station and buy gas for the car. I needed some gas the other day, and she says, "Okay, I'll go and pump the gas and everything. If you want to ride down there, you can ride. Otherwise, I'll take the truck and fill it up myself. You're not getting out to pump gas." And I said, "Well, there's a threat." She says, "The threat is somebody might walk up to you that's got this stuff and just start talking. You don't want that.
Mm.
Or you might touch something that's contaminated, and even though you sanitize your hands and wash them and all of that, you might get it." So, she's really concerned because, like you, I'm in fairly good health, for my age and conditions and everything, but I certainly don't want to tackle that stuff.
Right, because it would be an extra stress that we don't need at this point in our
Absolutely.
lives. I mean, none of us needs it, but anytime, but it's there nonetheless. And as you say, gas pumps are one of the places where you never know who touched that gas pump last. So you want to make sure that you use a glove or a paper towel or something between you and the actual lever. And it is a risk. She's quite right. So since you guys have that option, it's very kind of her to take that on and not expose you to those germs. You mentioned that she's not been working. So like a lot of households, people are getting laid off. So tell me about the stresses around that.
Well, our situation is if she is off a month, she loses her health care coverage, which means I lose mine.
Ouch.
And I've got a scan that I'm scheduling to go see my oncologist. I canceled my appointment with him in April, and I don't really have any serious concerns, but we had a slight change in January from the past pattern, and we wanted to follow up on that. So we're trying to get something set up. And I told him, I said, look, I need to get worked in before the end of May because June the 1st, we may not have insurance. So
Ouch.
that's an added stress. And there, on the other hand, there's a company that's close by where I live that they usually employ temporary workers around the holiday seasons and put things together for Christmas and and Hanukkah and everything else. And it's a gift place. Well, I would imagine they're making some sort of medical devices now because their parking lot is packed. I've never seen so many cars there, and they're working like 12-hour shifts, and they're there on Saturday, they're there on Sunday. So these people are, I don't know their working conditions, but they're in a work environment where they're probably close together and the social distancing is just out the window there for them. So if
Mm.
one person gets it, the risk for the rest of them to get it is high also.
You know, I was in a seminar this morning that was sponsored by the National Organization for Rare Disorders, NORD. It's rarediseases.org, and they've had a number of really good Zoom conferences recently to talk about how we can get back to normal. When do we think we might get back to normal? And they were saying that the vaccine will probably not happen until 2021 because it needs to be so thoroughly tested. But that between now and then, we're likely to have some better treatment options and some better testing options. So when you were talking about people having to work closer together, if we were able to test all those people and make sure that none of them was actually carrying the virus, then it would be fine for them to be working side by side. But right now, we're taking a chance every time we go into a large group that just one of those people who may have no symptoms at all could be shedding virus and infecting the rest of the people in the group. And that's one of the scariest things going on right now.
That's true. The temperature is not necessarily a good indicator, because when they check your temperature, if you're not showing a temperature and yet you're shedding that virus, you're going to get in the door and like you say, to have some kind of a situation. You know, uh, Dr. Anthony Fauci said yesterday on CNN on Monday, May the 4th, on an interview on CNN, it's the balance of something that's a difficult choice. Like how many deaths and how much suffering are you willing to accept to get back to what you want to be, some form of normality sooner rather than later. And, all of us want to get back to normal, but we've got to find that balance because Joyce, it can be critical. And you were mentioning the fact, do you go to the doctor? It's almost an individual decision that we have to make because if you live in an area where there's a high incidence of the COVID-19, the risk of you in encountering somebody else with it is a lot higher than if you're in an area where it hasn't spread or it has been stabilized fairly much. So it's almost an individual situation that you have to weigh out.
Right, and they're advising people not to just pick up and go to the doctor, but to phone first, because they'll walk you through some questions over the telephone to do some pre-screening and see if what you're dealing with might be COVID, and also the urgency of your situation. Do you really need to come see the doctor, or could you just get some medication or something like that? And the third element is how busy is that office? Because as you just said, if there are people with COVID in the office, you really don't want to go there. So, work with your physician to determine just whether you can manage at home with a little bit of support or whether you
Sure.
really do need to go to the doctor's office or the hospital.
That's true. On my scans and stuff, once we get those set up, we're probably going to do a phone conference or a video conference with my oncologist. And of course, that's something that a lot of people are not used to. But the doctors are saying that are having to experience that. I see it on WebMD and some other places where they talk about things like that. Kevin MD, there's some people that are talking about it. The doctors are able actually to interact more with a person by a video conference because the way the Medicare guidelines and everything are, they don't have to sit there and be punching all that information into the computer like they do when it's a face-to-face visit. And that's something my mom used to just really raise the walls with every doctor she went to. She said, you need to look at me instead of that computer that you're always looking at. I come in to see you, not to watch you play with that computer. And, they have to do that because it's medical requirements. It's insurance requirements. But with these video conferences, they're able to look more at the individual because it's recorded and they can go back and capture it later.
Right, right. That's a good point. Yeah, I think it's a new way of doing, but it's almost like a house call. We haven't had house calls for a long time, but now you can actually talk with your doctor from the house and not do everything that you could have done in the office, but you can do quite a great deal. And obviously, if you need blood tests and other things like that, those are more hands-on. But certainly all the basic questions around diagnosis you can handle over the internet. So don't be shy to use it. It really is very good. And it's also a good way of social connectedness too. I work a lot with the senior center here in Boston, and I usually teach a quilting class. And since the middle of March, we've had Zoom quilting classes. Even though some of my ladies don't have sewing machines at home, we've been talking about mending. Everybody's got mending to do. So learning strategies for mending and how to do things like that. And it's just nice to get together and chit chat. This morning we just talked. We didn't do anything particularly productive, but we had a good time together. It was pleasant. So reach out and touch people however you can, by telephone, by Zoom, by whatever. It's good for you. I know you normally would be doing a lot of volunteer work at your local nursing homes, Mike. So what other kinds of things are you doing to stay busy and keep your mind occupied?
Well, with Yvonne working and me involved in volunteer activities and everything, sometimes the to-do list around the house would just get put off. And we found a tremendous backlog of stuff that has to be done, that needs to be done. Some extra work in the yard that we've been putting off for years, or taking care of a project around the house. And then there's some major renovations that we've been doing, and so I've been getting my exercise. One of the little online things that I do with my cell phone is a survey that's out by one of the University of California at San Francisco. They're tracking the COVID-19 and asking for symptoms and everything, and how many people you encounter every day, and all kinds of things. And one of the things they ask is, have you been active today? How many minutes of exercise have you gotten? And so sometimes when I count up how much I've done today, I think, wow, I didn't do that much, did I?
Yeah, step counting is good, or if you have an exercise bicycle, but just getting out and walking around the block with a mask, 6 feet away from other people. I've noticed people are even keeping their dogs apart. We used to say hello to other dogs, and now we're staying 6 feet from another dog too.
And the thing about it, they haven't fully developed the idea yet, but I think there was an article that I ran across someplace that somewhere in Chapel Hill or Duke or somebody, they had actually had a dog that had come down with COVID-19. And one of the last times I was in Lowe's, and that's a plug for the home building store, the last time I was in Lowe's, there were a couple of people in there that had their dogs with them. I mean, they love to bring their dogs to Lowe's, and
Uh-huh.
I don't know why, but I'm thinking, with this virus running around and everything, and the dogs sniffing the floor and sniffing everybody and everything, that's a ideal candidate for them to get sick if it could be transmitted to a dog in an environment like that. So,
That's true. And just petting somebody else's dog, you could be picking up the germs from when they petted their dog. So
sure.
it's another opportunity for transfer that we need to be wary of.
Yes.
Yeah. So yeah, pent up things around the house. We need to really keep ourselves busy so that our minds don't dwell on every little twinge, every little symptom, and try to find a way to talk yourself down out of when you're beginning to what I call awfulize. If this happens, it'll be awful, and something worse will happen, and something worse than that will happen. And so it's very easy to start awfulizing, and better to somehow have a way to relax yourself and to bring yourself down from those panic attacks.
And one thing that is probably vitally important that so many people never think of, instead of watching the news, instead of watching all the videos, instead of doing all that, turn on Everybody Loves Raymond reruns or Bob Newhart or something, and just kick back and just lose yourself in that silliness, and just relax and laugh. Because I had a friend that right after the lockdowns around here first started, said to me on Facebook Messenger, she said, "Boy, this stuff is bad." Said, "I'm really scared of it." I said, "Turn the news off.
Right.
Just be cautious, follow the guidelines, but turn off the news if it's getting to you."
Very good advice. I think one of the other things is support your local businesses, because the small businesses locally are really hurting. And my local movie theater has come up with ways of distributing the movies over the internet. Either you can pay and they'll do a closed broadcast of the movie, or they have discussions with some professor from Emerson University talking about Rear Window or something. And so we've watched a lot of old movies through them, and of course through the various streaming providers. Last night we watched Heidi.
Oh my goodness.
With Michael Redgrave, Vanessa's father. It was amazing. So yeah, watch feel-good movies, or every once in a while we alternate and we watch some really scary movie. We watched Deep Impact the other day.
Okay.
And I would recommend that for any big, because if you think it's bad what we're going through now, it could be worse. It could be hit by a meteor that's going to blow up the earth. So yeah, so sometimes it's good to watch the scary ones and just remind yourself that as much as we're going through, it could be worse. Let's just get it all in perspective.
Absolutely. And they haven't fully figured out this disease yet in some of its properties or anything, and there's going to be new developments coming out on this consistently. I hope the vaccine that they're talking about for 2021 is going to be on target, but that may be a little optimistic for them to really have a workable vaccine. It may take longer than that, but we have figured out that if we do the social distancing and if we, take care of ourselves, wash our hands, be careful, wear masks and everything else, we'll be okay.
That's
It'll
right.
help.
There are three primary components that we all should be doing. Whenever we go outside, wear a mask, stay 6 feet away from anybody else. You can talk across the street, it'll work. You don't have to be an arm's length away from somebody. And the third major thing is that remember that your hands are the best way to carry germs to your mucous membranes, to inside your body, your eyes, your nose, your mouth. So try not to touch your face when you're outside. When you come home, wash those hands and make sure those hands are clean before they touch your face. We all instinctively touch our faces multiple times an hour. So wearing a mask is one good way to remind yourself, oops, I'm not supposed to do that.
That's
So
true.
those three things, if you remember that. I have a friend who was being manic about cleansing every surface in her house. And I said, wait a minute. That's inside your house. Nobody else is touching that surface. You don't have to clean it every minute. But you do need to be aware of when you put some external thing down, is there a germ that you might be carrying to your face? That's the primary thing.
And when you go out and you've really been into some areas where there has been high traffic, maybe not right at the moment you are, but a frequented area such as a checkout line at a grocery store or something like that,
Right.
you may want to consider taking your shoes off before you go inside the house and kind of cleaning them, because you might be tracking that stuff in. I mean, that's a possibility because as it falls to the ground, if your shoes are there to catch it, you can actually bring it home with you.
Yeah, some people have decided to go shoes off in the house, and that works out to be pretty good. But you should use slip-on shoes if you're going to do that, so you're not handling your shoes with your hands. Remember that your hands are going to carry whatever's on your shoes up. I learned that when I went to India, by the way. So in India, because animals roam free all the time, cows and everything wandering in the streets. My doctor said to me, just remember, anytime you touch your shoes, you've got to wash your hands because you just assume that there's fecal matter on your shoes. So
Absolutely.
today, as Mike just said, there could well be some COVID virus on your shoes. So pay attention to that too. But anyway, these are exceptional times. We will get through this. It's not going to end tomorrow, and it'll take as long as it takes to keep us safe. And I hope that everybody will come through this just fine. Mike, do you have any other words that you'd like to add?
Well, I I'm afraid to run this by my psychiatrist, before we air it, because he's going to say you're crazy anyway. How can you tell people how to stay sane during this situation? But there are those techniques that are out there, and if you have to, just Google keeping sane, and laugh a little bit, ease up. And if you've got the COVID-19, just try to do everything you can one day at a time, and hopefully it'll get better.
Right, absolutely. And YouTube is a wonderful source, by the way. It's the second most popular search engine that there is out there. My brother has used it for everything from how to install a toilet. So, but you can find wonderful videos there about meditation, about techniques for keeping you calm and calming you down when you're hard. There's a lot of yoga. There's a lot of exercise videos. There's videos to help you learn how to do things around the house that you haven't gotten that handyman to do, and maybe you could tackle it yourself. Don't get too crazy, but but you can learn some new stuff out there. My son is taking harmonica lessons over the internet with
Wow.
a harmonica teacher in California. So we're doing Zoom conferences for harmonica lessons. So learn a new trick or two. It's good for you.
Yes. Very
Yes.
good.
So everybody be well and stay safe, stay indoors, and be a powerful patient. Thanks so much for joining us.
Thank you. Have a great day.